come together. Man, that's a pretty good message these days, isn't it?
A good message.
We are back in the Element Well Studios. Joining us now, Tim Moore, President and CEO of the Mississippi Hospital Association. Tim, thanks for coming in.
Hey, Gerard, thank you. Glad to be here.
Yes, sir. So I caught a report published in Bloomberg last week that was taken from an analysis done by the consulting firm Kaufman Hall on behalf of the American Hospital Association. And the report indicated that 53%, more than half of the hospitals in this country, are on track to lose money this year. And that was a rather startling statistic, in my view. I caught one a couple of years ago. You may remember this, Tim. It could have been a little longer than a couple of years ago, produced by KPMG, one of the big four accounting firms, which indicated that 75% of the community hospitals in this country were cash flow negative.
Yes.
Does that sound
absolutely
plausible?
No.
I mean, I know you're in this. These are your members every day.
Absolutely. And I spent or have been spending quite a bit of time with them lately to hear those stories. Matter of fact, that same Kaufman Hall story goes, actually, that was a range. Okay. Bloomberg used the 53%, but it goes up to 68%.
Okay.
So it's even worse than what you're saying. Yes, startling news. Particularly on a state basis, it's actually worse than the national basis.
I figure.
Gerard, I have talked to systems, independent hospitals, small hospitals, and the best case scenario I'm finding for budgeting in 2023 is a break even.
Okay.
Everybody, the big systems are all budgeting losses, big losses. You look at what has happened this year, just astronomical, historic losses in our hospitals. And, of course, it's not sustainable. It wouldn't be in any business. And let's back up and sort of set the stage for this. In 2019, we did some research and looked at cost reports, which all the hospitals file with CMS every year, so you know kind of where they stand. At that time, the industry in the state of Mississippi was losing $11 million a month. Now, that's prior to COVID. We mask a lot of that with the CARES money, with the loans that came from Medicare and some of the other things that came through. Well, unfortunately, the CARES money is gone. Now our hospitals are being required by CMS to pay those loans back, those that took those loans.
Right.
And I tell you, most of them took the money in anticipation or at the time, not knowing what was going to come and what was going to happen, so they just banked that money. So it made your balance sheet look really good.
Yeah.
Now they're paying it. I had a hospital tell me Monday, I'm writing a check for $7.2 million back to CMS Friday. They never touched the money.
Okay.
But it's going back now.
So they reserved it for the time at which they had to repay it.
That's correct. So that's where it is.
So, here's let me pose this question from a patient perspective.
Sure.
You go to the hospital, you get out, you're there for a day or two, and thank God that with the advances of medicine, most hospital stays for routine surgeries are short in nature. I mean, it's come in, get your surgery. They pretty much send you on your way, which is a good thing because we've advanced the technology such that surgery is not as morbid and doesn't require as long a recuperation time, which is good. So we free the bed up, we get you off the expense ledger there. But you get the bill, and it's insane high. And so I think the average patient says, how could they be losing money based on this? What's going on?
Well, the biggest component there is the bill is certainly not what's going to be paid.
Sure.
And it's going to be a fraction of that. In most cases, it's somewhere around 30%.
Okay.
So, and in some cases, depending on who the payer is, it may be worse than that.
Yeah.
So that's the issue. We have seen historic increases in expenses. Okay, supplies, drugs, the big one, labor.
Yeah.
50% of a hospital's expense customarily was made up by labor. Just in that same Kaufman Hall study that you referenced, there was a segment there about contract labor. Normally runs, now this is nationwide.
Yeah.
Thank goodness Mississippi has not normally used as much contract labor as they have in other states.
Okay.
But the typical hospital would have 10% contract labor that they would fluctuate up and down as the census goes up, as the need came.
Sure.
That is up to over a third now. 33% of their cost. Contract labor.
Which is, I'm going to guess, triple what a full-time employee would be?
I did a little math this morning. It was about 234%.
Close.
You're real close. You're real close. Pretty good guesstimation there. That's good. That's real good. So, that's not sustainable.
No.
There's no way. The stores, and it's no longer just the medical clinical staff, because everything has gone up. We've seen the inflation rates go up so much. I had a administrator share with me a story that occurred over the weekend. He and his son were coming back from a ball game or something. They stopped at Burger King. They pulled up in the window, and a big smiling face to give them their Whopper, was two of the best dietary employees that administrator had. And They said, "Hey, Mr. So-and-so, it sure is good to see you. We hadn't seen you in a long time."
Mm-hmm.
And then, of course, his son starts asking, he said, "Dad, why are they here and not at the hospital?" Because the Burger King can pay them $5 more an hour than I can.
That's unbelievable.
So that's the competing force you got. Now, not only with our nurses and techs and things like that, but, and you start asking from their perspective, everything's going up that I buy. So I can't take the cut now because it's all going up. Well, the hospital can't keep funding it without some help. So we are trying to get very creative and look for ways that we can do some things and get some more money into the hospitals.
Yeah. To those who would say, being a little bit of an antagonist, I guess some would say, but to those who would say, well, you're not accurately reporting the financial activities that there's, because it is complex. Let's be honest.
Very complex.
It's different in that, as you know, you got multiple payers, and what you sell has got a multitude of rates associated with it. At the end of the day, it's not like I'm a vendor, I'm a supplier, I'm a seller of some product and services. I pretty much have a standard catalog of pricing. In the healthcare industry, it'd be equivalent to walking into the Burger King and there being 5 prices for a Whopper, depending on who's paying and who's buying, essentially.
Yeah. It's
complicated. So what do you say to those who say, well, you guys really are fudging a little bit on the books here to make it look worse than it is?
Yeah. I would say that the complexity of healthcare is creating a real disconnect. If you look at our situation, what has happened to that Whopper over the last 3 years? It's gone from, I don't know, what $2 to $5.
Seems like it to me, yeah.
I mean, I'm just throwing that out, okay? Well, hospitals have not had that option. The price is what it is. All the expenses have gone up. The payment for that service, which is very complicated because we're all different, and it's so much of a challenge. If we come in and have a gallbladder, and you do great, you're in and out, maybe you can go home that afternoon. Well, I have complications. Something in my body didn't work just right. Something was different. It's not an exact science. And it's why we've always said you call it practice in medicine, because it's always something different. And you have to realize that burden of additional care costs more money. Now, what have we been challenged to do on the transparency websites is to say how much that's going to cost. We're trying to do that. The best way to do that is go to the insurance company and show you what they pay. This is what my part's going to be, and this is what my insurance company's going to pay. That's who has all the numbers.
Yeah.
Because they got the averages. They know what they paid on everybody in the state. So that's where it needs to go. And then when you start talking about fudging on numbers a little bit, let's look at all the hospitals that are on the verge of being in negative or going out of business. We're seeing hospitals close. There's about 5 hospitals that are on the brink right now of shutting their doors.
In Mississippi.
Yeah. And everybody knows most of those.
Yep.
Well, our insurance companies are showing record profits.
Okay.
Now, why is that?
Okay.
That's a challenge in my mind.
Hold that thought. We got a break right here. We'll come back to you. Can stay with us?
I'll stay with you.
Yeah, we got Tim Moore, President and CEO of the Mississippi Hospital Association. We're coming right back in the Element Wealth Studios. We've got Tim Moore, President and CEO of the Mississippi Hospital Association. So You were just going down the list of all the various challenges, and I just shared with you, Tim, that while we're on the air here, I get an update from one of the services I subscribe to that tracks what's going on in the healthcare industry, in particular from an economic and perspective and financial perspective. It says that because of the cuts in Medicare that are scheduled to go into effect October 1, essentially, looking at $600 million of losses of revenue to mainly rural and community hospitals, is what they're saying.
That's correct.
That's a big chunk of money out of there. And you were just sharing with us about the number of hospitals in our state that are upside down. But before we went to break, you also referenced the insurance industry, the healthcare insurance carriers, and how they seem to be producing quite tidy profits. So
they do.
Tell us about that.
Well, you can look at or pull almost any of the insurance companies and look at the stock price or actual returns. They have done significantly well over the time that we've gone through the pandemic and then also coming out. Certainly there has been a decrease in the utilization of health care because it kind of got pinned up and nobody wanted to come to the hospital because they were afraid they'd get COVID.
Right.
And, of course, that created some critical situations, too, because people that needed to be at the hospital were afraid to come. So certainly when they got there, their expense went way up.
Yeah.
But volumes have been down. But when you look at the rates that come back, and we talked a little bit about this, any other industry is able to adjust prices as their costs go up. Healthcare is not that simple. It doesn't work that way. You negotiate with third-party payers for care that you provide for another party. So they try to pay as little as they possibly can, and I don't know of many opportunities in the state of Mississippi, particularly independent hospitals, that have a strong lever or leverage that they can negotiate a rate with any of the big payers.
Yeah.
They basically get a contract. This is what we're going to pay you this time. And then sometimes it may be, we're going to tweak this. We're going to give you a little bit more money for this procedure, but we're going to take it away over here. So it's going to be budget neutral. Don't worry about it. It's all going to be okay.
Yeah.
So, we've got a real complicated scenario for our patients to try to understand. And to be perfectly honest with it, even some in healthcare don't understand the complexity of what we try to do. But at the end of the day, we know that expenses are going up 15 to 20% or have since 19, and revenues are still flat or 3 to 5% increase.
Okay.
So that doesn't work. There's not an industry that will survive without subsidy. And I laughed though. I heard talking about the EVs, and talking about how what a wonderful thing it was and how inexpensive it was going to be. And then all of a sudden, typically, if the government gives a subsidy for it, it's not going to be cheaper.
No doubt about it.
So
no doubt about it.
We're in a situation that we're going to have something from somewhere, or you're going to have hospitals closed across the state of Mississippi. So, you're going to lose services. If I can say one other thing on that, I had a good friend of mine that we were in a discussion actually with, and this has probably been 10, 15 years ago, and we were in discussion with some lawmakers and saying, y'all got to do something about cost. I mean, you got to cut this. And he's sitting here, long-term administrator, that's saying that, look, we can fix it. We can make this a profit center if that's what you want. Now, you're not going to like it. You're not going to like that situation. But we'll come in the morning at 7 o'clock, and we'll start surgery. And we're going to be finished by 3:30, 4 o'clock. So we're going to close at 5. Now, if you need anything after 5, you just hang on. And if you live, we'll be here in the morning to take care of it.
Right.
People forget hospitals are there 24/7, 7 days a week, 365 days a year. It never stops.
Right.
So you have to provide staffing and supplies to be able to handle whatever you're anticipating will come in.
Yeah.
So it's complicated.
Yeah, and so they're along the lines of, or related, I should say, to the discussion about the carriers. Virtually across all the business media, you see suggestions that premiums are going up next year.
Yes.
Mainly advising employers.
Right.
Get ready for group coverage. You're going to have to make a decision. You're going to absorb the increase
or pass it
on to your employee, combination of the two, what have you. But, Tim, it's also true, though, and again, I'm not being defender of the insurance companies here, but as you know, they're bound by law, by the ACA, to pay 80% of their premiums out in the form of claims, and anything if they're not in line with that ratio, they've got to send rebate checks out. And billions of dollars have been sent out. They're not necessarily large individual amounts, but I think Anthem in California has been tagged with the most.
Yeah.
So I'm just wondering, given this last year or so where we have seen United Healthcare, Aetna, Humana have all posted tidy profits, and that's probably 50% Anthem. That's 60, 70% of if you combine. I think the top 5 have 85%, if I'm not mistaken. Cigna is in there. But I just wonder if we're going to see some rebate checks going out. But then you're going to turn around and get hit with higher premiums. And I don't know what the situation here is in Mississippi, but it's a mess because we have this multitude of parties involved in the transaction. Correct. And that, to a great extent, is a function of government intervention. Because we got Medicare, Medicaid, TRICARE, private insurance, Obamacare exchanges, individual, group. It's ridiculously complicated. It hurts your head.
It does. It does.
Just trying to understand it.
We're challenged with it every day. And, that's one of the things that we have tried to lobby for, and that is consistency with payers. And somehow that works in their advantage for it to be inconsistent, because claims can be denied much easier. If you have to do it, you have to be the one processing a claim, and you have to be sure that you're doing it the way this insurance company wants it. And if it's not, you did it like the other insurance company wants, then it's denied. Yeah. It's a challenge there as well, and it needs to be right. There's no question.
What are you pushing in the 23 legislative session coming on? What's your priorities, the group?
Well, we've got several things. Most of them around funding, but we're still working to finalize the agenda. It'll actually go to our board in October. Okay. But some of the things is a lot of folks may not know that the hospitals pay a bed tax. Right. And it funds the supplemental payment, the state portion of the supplemental payments that come back to hospitals from CMS. There needs to be some heavy discussion on either that being lowered or even done away with at this point in time. Okay. I mean, we're all for cutting taxes. I mean, that shouldn't be as big an issue. And we've all talked about the surplus of money that we have. There is something that we've got to try to do for our rural hospitals. There's got to be, whether that's in the form of some kind of access payment or something like that, to keep our hospitals at a basic. We hear folks say, well, we don't need all the hospitals. Well, I promise you, if you live in that community where that hospital is, you're going to say that I need that hospital. Yeah. And you should. Should it be maybe in the form that it is now? Maybe not. Maybe it needs to be in an access point or certain services provided. And I'm all for that. And we have conversations about that constantly. But, Gerard, the problem, you have to have cash or access to resources to make changes. Sure. If you don't have resources, then it's hard to make a transition to another model. Yeah. And that's something that we need to kind of log. Okay, can the legislature help us with that? Help us get through a transitional time. If we don't do something. I had an administrator early in the week also tell me that every hospital, regardless of your reserves and how much you have set aside, there's a time when that runs out. Okay. So we all have a day. Yeah. Okay. That we close the doors. Yeah. And this particular hospital said his would be in the summer of next year. Okay. But everybody has one. You only have so much revenue. When you're sending out and paying for expenses and labor more than you're bringing in, just like any other hospital or any other industry, you're going to close. You can't do it.
Well, my concern is that we're headed for a tipping point sooner rather than later, and I don't know what all the solutions are. I know your group is working on it, and we'll present what you think you need, at least from the legislature, in some form or fashion, and we'll see where that goes. 2 seconds, the Blue Cross and UMC conflict, is that hurting your members as well? Is it causing a problem, and do you have a position?
Yeah, we've tried to sort of stay out of that. Yeah, okay. Separate contract negotiations, so it's not through the association, so we kind of stay out of that.
Makes sense. Appreciate it. Tim Moore, President and CEO of Mississippi Hospital Association, has been our guest on Middays. Thanks for coming on, Tim.
Thank you, sir.
Appreciate it. We'll come right back.